Hi, I'm Bobby Peer with TAPinto, and today I'm with Dr. Baer at Smith Chiropractic. Hi, Jeannine. I'm going to call you Jeannine.
Please call me Jeannine. Hi, Bobby. It's great to talk with you today.
I'm excited to learn how your past few months have been. So, Dr. Baer took over Dr. Patrick Smith's chiropractic practice, and it is in the same location. And I just want to catch up and see how have the past couple of months been.
Oh, well, thanks for asking. It's been great. The transition has gone really well, pretty smoothly, I think.
Good.
Dr. Smith and I really were focused on making sure patients had a really good continuity of care, that they were fully supported in that process, in that transition. And my, patient cohort coming from down the street in Sterling, being able to integrate them well into the schedule. And so we're really getting the ball rolling and really feeling like we're getting into a nice pace and process here. So it's gone really well. I'm really pleased. I'm really pleased to be here in August.
Because I was going to ask, what could you say that you are pleasantly surprised at how the transition is going so smoothly?
That's a great question. Through the whole process, it always comes back to, oh my gosh, I can't believe I also do that, or Dr. Smith also did that, or the synergy in the two practices was really amazing, and so it made it very seamless. But I think if we were to put something on it, was that the patients are really seamlessly integrating as as one in the office, which is really exciting. And I think the best thing is just they were feeling so supported and understood through that process of change. And I feel really good about that. I feel really proud about that. I'm really committed to that for patients. And I know that Dr. Smith was as well.
So I know we talked in May when the transition was really just happening.
Yeah.
And you said you're not going to change what already works.
Right?
Yeah. So balancing what Dr. Smith did and bringing in your own style of care, has that been seamless?
Yeah, that's actually been such an additive to patient care, for each patient and in their patient encounter and working with everybody, because it's a new eye. So things I'm bringing are really just additive to what they were already experiencing and getting with their care with Dr. Smith. So that's been actually a really fun part. And I think patients have been really excited about that part. So like you said, I'm not changing things at work. Our techniques really overlap, and our approach really overlaps, in the majority of ways. And a few things over here that Dr. Smith did, I'm up to speed on. And then a few things over here that I do is new or additive to those patients. So not only am I bringing new things to my patient cohort from down the road, but I'm bringing new things and a new eye to certain patients who might need it. And so I think that's only a really important thing in any patient and doctor encounter, is that you're coming with a new eye, but also understanding what's working really well. So that's really been, I enjoy that. That's just one of the things I enjoy about being a chiropractor, about being a doctor, is what can we do better? What can we do more of? How can we improve this? Or what are we missing? And bringing a fresh eye each time. That's a commitment I like to make to every encounter.
You have your own style. You had your own practice and identity.
Right.
So you just keep moving forward with what worked and keep on improving the chiropractic care.
Exactly. Yeah.
So I'll talk a little bit about chiropractic care today. In your view, what is the biggest misconception of chiropractic care?
I think the biggest misconception is that chiropractic care is a technique, right? So that you go to the chiropractor, there's something out it needs to go back in, and we're going to crack that sucker back where it needs to go. Like, I think that's the biggest misconception. So I think to kind of counter that myth a little bit is, yeah, there's a lot of techniques we do that make sounds and noises, but we're so much more than just a technique, right? You're getting an interaction with a chiropractic physician. We're gonna evaluate what's going on with you, not only if you're a new patient, but if you're a current patient. What do we need to do? So as a chiropractor, we're making decisions about treatment protocols. We're making physicians, assessments, and maybe we're going to refer for diagnostic imaging. Maybe we're not. Maybe we're going to add exercises. Maybe we're not. But we're also choosing among the myriad of chiropractic techniques out there, which some make noise, some don't make noise. There's instrumentation. Tables do a lot of the work. So it's not just about the hands, but it's also about the thoughts.
I know that there's a product that Dr. Smith had used, and it was more about the vibration of
Yes, yeah, absolutely. So there's another technique that vibration, I mean, not to get into an entirely different technique topic, which is like amazing, but vibration is a really great tool to use for joint health and improving joint health, like in shoulders, and knees, and hips, and working with the capsule. And we can talk about that another time. But yeah, so there's so many more techniques. But I think when patients think about they're going to see the chiropractor, oh, they're going to crack my neck, or oh, they're going to crack my back. Is that going to be okay? And there's so many more things that we do than just that. So I think that's, to answer your question, I think that's the biggest misconception.
Okay.
It's a profession, not a technique.
Right. Yeah. And also, I mean, because we all could use chiropractic care at some point. When is a good time? Absolutely.
Right.
When is a good time to come in? Because a lot of times people wait until it's so painful. Like if they have a pain in their spine or shoulders, or wherever they do have pain, it gets to a point that maybe they could have prevented more injury.
I think my answer is going to surprise you.
Okay.
On that a little bit.
Okay.
I think that's true about any health care issue you're approaching as a person, as a human. To come into the office to see me is anytime. When is the right time to come in? Anytime is the right time to come in.
Okay.
Don't delay. Don't wait. Get ahead of it. But if you haven't, don't also worry about that part either. Come in any of the times, right? Do I have a preference? I do. I don't want to see you hurt. I don't want to see you in so much pain. I don't want to see you suffering. This is why I do what I do, what I love to do, but you could come anytime.
Okay.
And I'm happy to see you at any time. And I'm never going to say, why did you wait? Or why didn't just come when you can?
Don't be afraid.
Repercussion
of the doctor scolding you.
Yes, just get that off let's take that right off the table. Good. Because that's not good care, right? I'm going to meet you where you are.
Okay.
Might I have some suggestions? Or don't wait, because you don't have to suffer, right?
Yeah.
There's a lot of options and a lot of ways to approach something that I may have a really good idea about because I'm an expert at what I do, and maybe as a patient they have a more narrowed idea of what we could do. Don't try to figure it out all on your own. Come in and ask me.
Great. I mean, and I know that chiropractic care is used for other ailments such as headaches or even stress, right?
Absolutely.
Isn't there? There's a remedy. So we can save that for another time.
Sure,
I would love to further that conversation.
Happy to do it. Yeah.
Because headaches and stress are part of parenting.
Oh, don't I know it? Don't I know it from both sides? Don't I know it? Yeah.
So I would love to continue that conversation. But for now, we're in the middle of August.
Yeah.
Smack in the middle of August. Sports are coming up. Are you seeing more athletes that need chiropractic care on a regular basis to really prevent injury on the field?
Yeah. Great question. absolutely. I think a lot of it, we're seeing a lot more, or I certainly do, and I know in this office in the past,
Mm-hmm.
we see a lot of athletes, particularly getting into this time of year, but just in general, a lot of high school athletes, because practice intensity, training intensities in general have ramped up. So if you think back to when, and it's a long time ago, since I was in college, I played soccer for my university. And when I look at the training that we did um, at university level, is what it looks like at high school level now. And it's very focused, and good or bad, whatever, it's just they're year round focusing on the one sport, so we're missing a lot of that cross training concept. So we do see many more athletes, particularly high school athletes, developing bodies, adding more intensity, lots of injuries. So I typically recommend for patients that we see, and then new sports and athletes, patients that we see, if you're in your sport and you're doing pretty well, you're feeling pretty good, you're injury free, we do like to get you in pretty routinely while you're in sport and when your training intensity is a little bit increased. So we're looking at like routine care,
Okay.
just kind of keeping things well. Just as you would be stretching, just as you would be, maintaining your cardiovascular activity, you're maintaining your good muscular and joint health. That's really key. And of course, with injury stuff, that depends on, what injury that, you might have incurred, and how that might look more in a crisis kind of care situation. But I'm always gearing to like do the most I can in the least amount of time that it takes, so athletes are back out doing what they need to do. And that's
Good.
really the kind of the directive and the focus. But yeah.
Great.
Yeah.
Now, I did see that you recently were published, and it was about the backpack.
Yeah.
Can you give any advice to moms and dads that will be viewing this?
I love to give backpack advice. So yes, I for years have talked about backpacks, backpack safety, backpack health. Upcoming, I am doing at every August I do an interview with Jen Arcillo at NJ 1015
Awesome.
on backpack safety. We talk about it every year. You want to make sure that you're getting a backpack that has 2 straps, and those are padded straps. We want to make sure we have a padded back, so that padded back is up against the body of the student. We want lots of compartments, multiple compartments, so that you can pack things in different ways, and it distributes the weight of all those things,
okay, that makes
like
sense.
over the body better. That they're wearing both straps on both shoulders, right?
Okay.
We have 2 shoulders and there are 2 straps. That is not a coincidence. So we want to wear it like that. Also, we want to check periodically the weight of that backpack. So I do a lot of work with the Association of New Jersey Chiropractors, and we recommend that the backpack weigh no more than 10 to 15% of total body weight. We call that like the yellow zone. If you're 10 to 15% of total body weight, you want to maybe get in there and take some old things out. Do you have library books that don't need to go in there? Half drunk water bottles? Is there a bunch of change at the bottom of the backpack? I don't know. Clean that out.
That sounds like a locker.
It is. You know what? You make a good point, Bobby, because especially in the high schools,
they don't have time.
They don't have time to go to their lockers. They're literally, their backpacks are their locker. So be checking that periodically. Get them into the good habit of doing that.
Good.
And if it's less than 10% of total body weight, we call that the green zone. You're good to go. You don't really need to check anything. And if it's more than 15% of total body weight, which, to be frank, most backpacks are, they're so heavy, they carry so much. You need to be kind of rearranging those things and kind of, why are we carrying everything? Do we need all these things? But yeah, because it's now a locker. So
it is.
Yeah.
I know that. So that's great advice. And I look forward to future conversations on tips that you may have. Can we talk a little bit on the personal side?
Sure, please.
Since I'm here.
Please. Happy to do that.
So outside of work, what do you enjoy doing?
Well, I mean, I'm so busy, but I enjoy, we have 2 dogs. My husband and I have 2 dogs. We have 2 boys. We enjoy family time. We enjoy watching movies, old movies. We like watching, some science fiction movies, mystery movies. We enjoy that. Old school stuff we like too. We also like to drive in our cars. We have a couple
Okay.
of fun cars that we like to do, drive around and tour, like some of the back roads and areas
Okay.
in our
Nice.
beautiful state. We have so many beautiful areas to tour and look through. And so we really do enjoy doing that as well. I like to walk. I try to take a walk every
Awesome.
day.
And I was going to say, you are from the Long Hill area.
Yes.
What's your favorite place to go to in Long Hill?
Oh my gosh. There's a lot
Or
of
the surrounding
there's
area,
a
I
lot of
should
my
say.
favorite places. No, I really love the Great Swamp. And
Okay.
I love living in the proximity of the Great Swamp. Um, and I know, and it borders so many different towns. But there's so many opportunities for education. We've got bird education, Raptor Trust is right there.
Yes.
Got all the walking trails right there. The boardwalk is beautiful, and going out to the bird hide. One of the things I really enjoyed was bringing my nieces out there. They were visiting, and
Nice.
we went out to the bird hide on the weekend, and they're always looking to get a count for species and different species you see. So we were able to see one of the herons that hadn't been counted that
Oh,
day.
very cool.
So it's just really neat. I
It
enjoyed that
is.
very much, and just we have such a wonderful balance of nature and access to things we need. So it's a great balance
I
living in Long
love
Hill and the
hearing,
area too. Berkeley Heights,
yeah.
of
Oh,
course.
I
Yeah,
mean, all
you
of our
probably, yeah,
surrounding towns. And
absolutely.
I always say, check out what's in our backyard because we have it all.
We really do.
So,
We really
well,
do.
thank you so much,
Oh,
Jeannine. And I
thanks,
look
Bobby.
forward to our next
Me
conversation.
too. Thank you so much.